Hi, I'm Maya McNulty. I'm a COVID survivor of the Wuhan variant, March of 2020. I was the first young female to have gotten infected and impacted by COVID, and I'm a long hauler, COVID long hauler, diagnosed in September of 2020, and I recently, September 1st, I tested positive. September 2nd was the second test that I tested positive for the Omicron BA.5 variant. I want to talk about relapse, rebound, and reinfection of COVID. Now, we're familiar with the common relapses from drugs and the medical community. When you relapse from a drug, you're going from pain to pleasure. You're getting that hit so that you can feel good. That's not what's happening with long haulers and long COVID. We do not relapse like that. Long COVID relapse is just the opposite. We go from pleasure to pain. When you're a long hauler, you are in pain, but you're living the pleasure of your life and not in pain from the relapse, the needing that quick hit. We're searching for a better option to feel better, a more therapeutic way of feeling better, not necessarily a chemical way. There's certain regimens and protocols that can trigger a long hauler to relapse, such as low oxygen level, like I had, hypoxia, or shortness of breath, depression, anxiety, PTSD. Those are all signs of relapses of going through long COVID. And even blood pressure or unknown body bruising, allergic reactions to foods, even water. I'm here in the hospital right now, and I've got a thing full of glacier ice chips because they help with my throat. This BA.5 gives you a throat infection type of thing. When I was here last, I was on a ventilator and trach, so thank goodness I'm not on that anymore. But there's bruising that will occur. Those are all signs of being in a rebound mode, not on a relapse mode. Rebound, it's when the virus, what it means is that the virus hasn't completely left your body. It hasn't entirely left your body. That you're being treated and you have treatments and drugs to help you to avoid getting long COVID and to shorten the duration period of time with the infection. But when you're rebounding, the virus hasn't left your body. The treatment is for a duration of time, and the duration can last anywhere from 10 days to maybe 15 or 14 days, depending on what the protocol is. I know that it changes for every medication. Like if you're on Paxlovid, it's a 5-day, but then you have that relapse and that rebound that we've seen many people have in the last couple of months. Today is my 4th day in the hospital here at Ellis Hospital. It's September 5th, and the infection hasn't entirely left my body. I'm on morphine, I'm on remdesivir, ortho, codeine, myopoprin, doxycycline. There's so many, I can't even remember them, and most of them I'm probably not even pronouncing right because I'm not a doctor. I'm a patient-led researcher, our marketer turned patient-led researcher to help people understand long COVID a little better. Now, the reinfections is certainly something to talk about. The reinfections is when the virus has left your body completely. For example, I had COVID back in March of 2020, and it took me about 27 weeks to walk again, 10 weeks to talk again, and all my hair, I lost all my hair, and that grew back. But the virus hadn't entirely left my body for a period of time. It could be 30 days, 90 days, 120 days, 6 months, 9 months, 2 years like myself. But a true infection can happen within 48 months, which is 2 years. An infection can happen. And it requires medical care. It's significant and it's important that you get rest and hydration and meal and seek medical attention Check your pulse ox meter to make sure that you're on enough oxygen. Right now I'm on 4 liters of room air, which is important to help me breathe, because I was admitted to the hospital because of hypoxia, which is the lack of oxygen in your tissues. It's important to be able to know how to take your blood pressure. They call it triage, your vitals, and your medication, and have a medication list so that when you come to the hospital, they know exactly what you're on, because things move fast in the hospital, and sometimes when you're sick, you can't really voice, and the fact that Omicron BA.5 is on the rise, you can't have other people in the hospital with you advocating. I spent 69 days in the hospital my first bout, and I did not have anyone to help me, and that was tough. That was super tough, and it was really dark. So I'm giving you little tips and advice for you to be able to make sure that you have your medical list of contacts, emergency contacts, your medical list of people that get your medicines for you. Also, your proxies and your medical prescriptions, have them in order. And then even phone numbers for your ride, if it's a Uber, Lyft, or taxi, or your person of contact. Just make sure you have that all, because things happen super fast in the hospital. Now, those are some different things about reinfection, relapse, and rebound. I hope that makes sense. I really wanted to share that because I know that there's some stigmas surrounding what is the difference between them. But again, all of them could require you to see medical attention, and I would encourage it. If I didn't come to the hospital in time, I probably wouldn't be alive. And the first time I was a little stubborn, and this time I don't want to be stubborn, and I'm hoping that you'll take my advice and that you'll listen and you'll understand and you'll be appreciative of what I'm sharing with you. So again, a relapse, it could be a drug relapse or medical. Just know that you're moving from pain to pleasure when you're going from a relapse of that nature. However, a long COVID relapse is going from pleasure to pain, where you're getting your life back. You're taking your life back one day at a time. And I learned all of this from my program I created, COVID Wellness Clinic, and I documented it all. And you can go to the link in the bio, covidwellnessclinic.com, and see what I've created to help long haulers. And this is why I feel that it's important for me to share with you. There'll be good days, there'll be bad days, but remember to follow your regimens and your protocols. Listen to your healthcare advisors. If you don't have a healthcare advisor, join our community at COVID Wellness Clinic. We're happy to help you. I know that anxiety is real. I know that shortness of breath is real. I know that hypoxia is real. PTSD, those are all signs of relapse when it comes to long COVID. And you're not alone. I see you, and that's why I have this program for you, and that's why I'm communicating with you and doing these videos, because it's for people like you who want resources and want support. And I didn't have it when I was going through it, and that's probably one of the reasons I survived, is so that I could do it for you and be here for you. Now I'm in my hospital bed, in my hospital room, and it's not scary anymore, but it was in the beginning. It was, and it's scary right now for my family. I have a daughter that graduated college 2 years ago. She was a junior, and she was scared out of her mind when she was told to come home, fly home to say goodbye to her mom in the parking lot via Zoom. I hope that doesn't happen to you, and that's why I'm sharing this message. So there's significant differences between relapsing, rebound, and reinfections. And when you're rebounding, it doesn't mean that you're not going to get through it, because you will. You will. I have faith in you. I have trust in the system, and I have trust in this world. So, but the body, it never left your body the first time, and that's why you're rebounding. And the reinfection can happen any time between 48 months. One is our immune systems is compromised, and maybe we're not as healthy as we were once before. And I want you to know it's okay. It's okay that you're not that person you were before, because whoever you're creating to be, you're creating to be a better person, that shining light, that beacon of hope for others. and you are ready for impact, and you will impact the world. I know you will.